Hi, Dr. Evangelist Milmas here at Kinetic Health. Today I have the privilege of working with Julia Harnett. We're going to be discussing some gluteal muscle stretches, some stretching exercises, specifically the gluteus maximus and the piriformis. The piriformis and the gluteus maximus are both external hip rotators, and the gluteus maximus itself is one of the primary hip extensors. Both are commonly involved in low back complaints, as well as sciatica, lower leg, knee, ankle complaints. They cover quite a broad range of different things that we'll see in the clinic here. Really important muscles, important stabilizers. So the first one we're going to look at is the gluteus maximus. So we've got Julia here lying flat. I'm going to have her pull in her leg, and what you're looking for is you want to feel where the tension starts. So Julia's quite flexible. She's a dancer, so she can go quite far. Some people will come into the clinic and basically, that would be the starting point. So we're going to have her pull it in. Right about here is where I'm feeling tension, and Julia as well, I'm assuming. So what we're going to do is have her grasp the knee with both hands, and we're going to incorporate some PNF, some proprioceptive neurofacilitation. Basically, she's going to offer some resistance, holding that for about 8 seconds, relaxing the muscle, and at the point where it relaxes, we're going to take it a little bit further and increase the range of motion. So we're going to start here. So you're going to have her push into her hands. You could also do this assisted if you have a partner, where I would place my hands here, reinforcing the knee. You're going to have her push in for about 8 seconds, and then relax. And you're going to take it just a little bit further within tolerance. Same idea, pushing in again for 8 seconds, and then taking it even further. And you want to do this about 4 to 5 times. So whether you're doing it alone or assisted, the key is to really concentrate on pushing and then taking it further every time you relax the muscle. It's great.
Hello, I'm Dr. Brian Abelson. I'm going to go over the piriformis muscle. As Evangelist mentioned, it is an external rotator, a very, very important muscle just underneath your glutes here. Why it's important is commonly the sciatic nerve will get entrapped in it. And it's kind of a strange thing. For some poor people, the sciatic nerve actually goes through the middle of the muscle. Other people, it goes underneath it. Other people, it goes on top of it. But it's a very common one that's affected in sciatica. So I want to make sure that we stretch this out. So we're going to do a little bit of PNF work on it. So we're basically going to take to the side here. We'll have Julia grab her leg here. Actually on both sides here on top. And then we're going to bring it to end range. And then we're going to have her move it this direction. So if her hands were here, I'd be trying to move it and taking it up like that. But she's not going to allow that to happen. And she's basically going to pull it in. And then she's going to force her foot in this direction here, trying to turn out for about a count of 8. And then after 8, she's going to allow this to go a little bit farther like so. Now we're going to do this, maybe 4 or 5 times. Pushing again for about a count of 8 and then pulling it in a little bit farther. But when we're setting up here, Julia actually pointed out to me a really good thing. A great way to do it is to place the other hand over here, is that correct? And then push here and pulling in at the same time. And then holding that position for about a count of 8. And then after 8 seconds, taking it a little bit farther. So for those individuals who have a little more range of motion, and you're trying to get a little bit more of the rotation aspect throughout the external hip rotators, this is a great way for doing this. Thanks for pointing that out, Julia.